are many Californians who are not receiving the behavioral health care services that they need. There is not a sufficient number of psychiatrists to provide the services for everyone who has this need in California.
20 to 30% of my patients in my clinic have psychiatric problems. A lot of them are undiagnosed, and that is very challenging for me because I cannot fix patients' diabetes, COPD, or cardiovascular problems without fixing their mental health problems.
A lot of times our providers, there may be a high turnaround or they may be recent graduates and they may not be completely comfortable yet in terms of the medication prescriptions for psychiatric illnesses.
We know that when behavioral health conditions are not recognized, when they're not addressed, when they're not treated, that can have a tremendously negative impact in many other aspects of an individual's life. We thought that we could expand our reach by investing in the hiring of a team of psychiatrists that could enhance the capacity of our primary care partners to provide psychiatric care to those with milder or moderate conditions.
This job is all about teamwork, and it's divided into two types of teams. One are the teams that we see on a weekly basis, the primary care providers, the behavioral health providers, and then the other team is the PCPCP team.
PCPCP, the Primary Care Psychiatry Consultation Program, it is a team of psychiatrists who provide consultation to primary care doctors. They're providing consultation to other behavioral health care staff.
The idea of these two teams is that if I don't know the answer to a question in the clinic team setting, then I have this whole second level of a team to ask the other psychiatrists how would they handle this situation. And so there's lots of layers that keep stepping up the level of expertise.
I deal with sometimes very complex patients who are not improving with therapy alone. The fact that I can consult Dr. Bagwar on complex cases, on diagnostic issues, on medication issues, side effects, has been really helpful.
Having multiple people working on caring for a patient is so much less taxing to an individual provider when you're on a team. When you're doing the consulting work we're doing versus seeing patients in private practice or an inpatient setting, you're seeing so many more patients. So the quantity of what we are doing is actually a lot greater.
We're seeing improved capacity to diagnose behavioral health conditions and to make referrals where appropriate.
I feel that when needed, help is around the corner. That helps me feel very comfortable in providing care to my patients.